This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how you can tell if you dislocated your elbow. So this video probably won't be very long, but you can tell if you dislocated your elbow because it'll hurt. Something happened, like you fell, like a traumatic event. It'll hurt really, really bad, and your elbow will be deformed and you won't be able to bend it and straighten it out. If it doesn't hurt terribly and you're able to bend it and straighten it out and it doesn't look funny, chances are you didn't dislocate your elbow. It's not a super commonly dislocated joint, and generally when it happens, you know that something is wrong. I would say if you do have that and your elbow hurts and looks really funny, I would go right to the emergency room and get an x-ray. There's two types of elbow dislocations, more or less. There's a simple dislocation and a complex dislocation. A simple dislocation is when the elbow just dislocates but no bones are broken, and usually they can pop that back in the ER and then you're in a sling for a handful of days and then you're kind of using the elbow and there's not really any long-term effects. It's one of those dislocations where you dislocate it and it turns out that not to be too bad. The other type can involve broken bones. You can break your radial head, you tear your lateral collateral ligaments, and it's much more complicated. And you can actually break, the other parts of the elbow as well. There's a certain combination called a terrible triad, which, anytime you break, your elbow dislocates and you break bones, you're getting surgery, and you're probably gonna end up with a stiff elbow, hopefully not super painful, but the goal is to get it stable. But if you have some funny popping in your elbow or anything like that, chances are you didn't dislocate it. And it's one of those dislocations that you're gonna know something is seriously wrong. So again, if you think that's the case or that happened to you, I would encourage you to go to the emergency room or see your orthopedic doctor ASAP to get it looked at. Simple x-rays are all you need, and then you can go from there. So hope I was able to answer your question about how you know if you have a dislocated elbow. If you have any questions I didn't answer, feel free to leave the questions in the comments below, and I'll do my best to respond, although I can't answer questions about your specific medical situation. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.